We're going to talk about a 9-year-old girl who collapsed suddenly, gone within seconds. Is cardiac arrest a growing concern amongst our children? And as parents, as guardians, are we missing the warning signs? Let's take a look at that. Let's turn our attention to a disturbing trend of sudden collapses amongst young children, with 2 recent cases highlighting what could be an unseen threat to their hearts. These incidents raise serious concerns about the health of our kids and what might be causing such tragedies. Let me start with the shocking incident from Rajasthan. A 9-year-old girl collapsed at her school playing ground, and the moment was caught on CCTV. The footage shows the child staggering before falling onto the ground. She was rushed to the hospital but was declared brought dead on arrival. Doctors suspect it was a cardiac arrest as there were no external injuries found. However, the family has refused a post-mortem, so the cause has not been officially confirmed. But what makes this even more heartbreaking is that her elder brother died in a similar way back in September last year. This means 2 sudden collapses in the same family within just a span of 4 months. Now, shifting to another recent case in Palghar, a 15-year-old class 10th girl collapsed right after finishing a school marathon. She had reported breathing distress before fainting moments after the race. She was quickly taken to the hospital but was declared dead on arrival. Doctors suspect it was a heart attack. These stories point to a larger issue, the unseen threat to young hearts. Experts say that up to 50% of such cases remain unexplained even after tests. These incidents often strike children who seem completely normal and healthy. Immediate actions like CPR and access to an AED can be life-saving in these particular situations. A family history of early sudden deaths puts children at high risk, and that's why early screening is recommended, including tests like the ECG, echocardiogram, lipid profile, and LPA levels. In some cases, genetic testing and cardiac MRI are also indicated. The key message is that early detection can help prevent these sudden deaths. 2 prominent doctors with us on the broadcast tonight, and the big questions that we're trying to decode. Should routine heart screenings become mandatory for kids, especially those with a said family history? How do we address the unseen threat when half of these cases show no prior symptoms? And what is really causing the rise in sudden collapses amongst our children? Padma Shri Dr. Sanjeev Bagai, Chairman, Nephron Clinic, with us on the broadcast, and Dr. Sanjeev Gera, Director and Head Interventional Cardiology at the Fortis Hospital, with us. Many thanks for taking on the time, doctors. Dr. Bagai, when a seemingly healthy 9-year-old collapses suddenly, what are the most likely medical explanations behind what is being called a heart attack? I know there is a thin line between a cardiac arrest and a heart attack, but in cases where siblings die in similar circumstances, it is quite fishy that the family has opted out of the post-mortem. Does that immediately raise suspicion of a genetic or an inherited heart ailment or risk?
Good evening. Extremely unfortunate incidents, and my condolences the family who lost their little one. But here, just going through the media reports, there was also a past history of the other sibling having a similar kind of demise not very long back. So overall, when you look at a sudden cardiac arrest in children, what we call as SCA, this should not be construed as a heart attack. Sudden cardiac arrest is an end point of a spectrum. Whether it's revivable or non-revivable is another thing. But it is extremely rare. It's more than 1 or 2 cases per 1 lakh population. Okay. Very big pediatric outpatient or inpatient. Perhaps throughout the year, you may not get to see a case at all. But having said that, more than 50-60% of the causes are often protean. They're hidden. They are masked. And the survival rate, especially if the sudden cardiac arrest happens outside the hospital or far away, is very poor. Less than 10 or 15% of the children unfortunately survive. But if there is a family history of a sibling already having such an event, and this child suddenly collapses and dies, it strongly points towards some sort of genetic or a familial cause. And these are basically along the lines of what we call as hypertrophic obstructive cardiomyopathy, dilated cardiomyopathies, arrhythmias, that means abnormalities in heart rates, certain ionic channelopathies, that means there are certain channels in your heart which are predisposed to give an abnormal flow either of the electrical impulses or of the contraction. And then there are other causes. But not so much of the non-communicable diseases or lifestyle diseases can give this kind of a picture, especially keeping the familial part in mind. With regards to your question of who needs to be screened and when, I think an antenatal history gives us a lot of information. When you talk in terms of an antenatal history, it's going through the pregnancy records of the mother, seeing what the past medical history is. Therefore, history taking becomes extremely important. A thorough clinical examination of all body organs at the time of birth is mandatory. If a child cries immediately at birth and you hand over the baby to the family, that's not the end of the story. Every child born needs a very detailed clinical examination, which includes the heart, the lungs, and hips and joints. These are often things which are missed. And apart from that, if there is a family history, clinically examine the child on every visit. Any suspicion, any doubt, or any history which points towards either lack of exercise or breathlessness or fatigue warrants examination, and do not hesitate in getting a cardiologist review formally.
Fair enough, fair enough. We have a cardiologist with us on the broadcast. Dr. Gera is with us, Director and Head Interventional Cardiology at the Fortis Hospital. We're hearing more reports of sudden cardiac arrest in children. Doctor, is this truly a rising concern, or are we simply reporting it and diagnosing it at the moment? And just like Dr. Bagai was talking about, how soon should routine cardiac arrests actually begin? What are some underlying symptoms, however subtle that they are? What should parents be on the lookout for?
So, we can't say that it is a rising trend.
Okay.
Because this is cardiac arrest, this is not heart attack. Heart attack is rising, but not cardiac arrest. But cardiac arrest, we need to find out what is the reason actually. So, anyone who has a family history of sudden cardiac death, especially sibling, then he needs to be screened by a simple test called electrocardiogram, ECG. Sometimes ECG can tell us that this patient has got some channelopathy or rhythm disorder. He is predisposed to those rhythm disorders like ventricular fibrillation, ventricular tachycardia, what we call exercise-induced rhythm disorders. Any kid who is, having sweating when he or she is playing with heavy work, or when there is some history of severe giddiness during exercise or fall during exercise, these are the pointers actually which tells us that there is some problem with the heart. Then an ECG and echocardiogram should be done. Or any, when child is born, the child was too blue, but he was not screened. So an echocardiogram is must to rule out congenital heart disorders like some holes in the heart, or maybe inversion of some different ventricles, right goes left, left goes right. So there are some congenital disorders. A very important history is high-grade fever. Sometimes high-grade fever, like what used to happen during COVID times, sometimes high-grade fever can involve muscles that can cause cardiomyopathy, even if the child recovers from fever. But in case the heart has taken the toll, then heart function can go down. And if such a kid just gets involved in some
Doctor,
activity.
When we're talking about the most common underlying issues, Dr. Gera, hypertrophic cardiomyopathy, arrhythmias, myocarditis, is there something else that you want to add to the list?
Hypertrophic cardiomyopathy, like channelopathies like long QT syndrome, short QT syndromes, which can be detected by a simple electrocardiogram. Then there is one term called ARVD, which can be detected by cardiac MRI and ECG. Then there are different like WPW syndrome. Sometimes they can have such type of rhythm disorders and congenital heart defects. Sometimes aortopathies can cause dilated heart, and that can cause rhythm disorders and sudden cardiac arrest and fall.